As you mentioned, we see it in our program, but believe it or not, actually, our program has one of the least dropout rates when you look at the statistics around the country. So despite all our efforts, we still see dropout rates as well. And of course, we will come to the reasons that we see. But a bigger question that I would like us to look into a little bit, Kamal, why is it when you have a treatment that clearly takes care of so many medical problems the person is suffering with, leads to extension of life, adding years to the person's life, adding quality to the person's life, why are people so reticent about it, right? We don't see that with other surgeries. When people come to my office and they gallbladder surgery, they've been recommended surgery to remove a part of their intestine. Or when the patients come to see our colleague, Dr. Vade, who does colorectal cancer, and patients have been recommended surgery to remove a cancer, there is no question. Patients follow up the recommendation to the teeth, right? In fact, their biggest question is, how soon can the surgery be done, right? And yet there is this. And in part, it has to do with the fact that we're still struggling to overcome this huge bias against obesity and its treatment, right? We are having still challenges in making people understand that we're not dealing with a lifestyle issue, we're dealing with a health problem. And with bariatric surgery, we have the most effective treatment when it comes to severe obesity. It has been proven, and bariatric surgery is one of the most scrutinized treatments for a number of reasons, and it's really safe, and the quality of outcomes has been proven to be very, very high. So that lingers over patients' heads very often. And of course, we see specificities. For instance, one of the common reasons we see people dropping out is fear of complications, because obviously surgery elicits a certain degree of anxiety, and that stops people from proceeding very often. And that's obviously different from other surgeries, as I mentioned, because people are anxious when we recommend gallbladder surgery. People are anxious when we recommend cancer surgery, and yet they overcome that anxiety because the sense of importance of that surgery overcomes that reticence. But that doesn't happen with bariatric surgery. So fear of complication is one of them. And the other one that I see very frequently is lack of support in their own family or friends.